We did a very interesting and rare operation 2 days back, that is on 10th of July 2012 at Yashoda Hospital, Secunderabad. We had a 63-year-old lady who has been suffering from heart problem for the last few months. And because of delay in diagnosis, her heart became very bad. Our chief cardiologist, Dr. Shishikant, has seen this patient. By the time the patient came to him, her heart was very weak. And he tried to improve the heart function of the medical management. But the reason for bad heart was she had a very severely narrowed valve in the heart. And unless that valve is replaced, her heart function is unlikely to improve. But with the bad heart function she has, if you do surgery, she has a risk of almost 100%. That's why we could not go ahead with the operation. But about 10 days back when she came to the hospital with severe breathlessness and she had to be put on a ventilator, her blood pressure went down to 60. We had to give high doses of medications to increase the blood pressure. And our Dr. Shishikant tried to open the valve with a balloon, but even after that she has not improved. She remained on a ventilator. And we have only two options, either to leave her like that to the nature or take very high risk and go forward. When we discussed with the family members, they were ready to take the risk. Fortunately, that time we had a device available in our country called left ventricular assist device. So far it has been used only 4 times in our country, and in AP it was not been used so far. And we used that device. We did the open heart surgery for her, replaced the valve because the heart is weak and it is supporting only about 25 to 30% of the body requirements. We put in a device called assist device. We took blood from the left upper chamber. It goes through this pump, which is kept outside, pumps blood back into the body. So this has done about 60 to 70% of the work. With this, the heart is slowly improving now. And when she was on a ventilator for 10 days, within 24 hours after surgery, we could remove the ventilator. She's talking and she's taking sips of fluids. She has shown remarkable improvement. Dr. Shishikant has done echo which showed some improvement in the heart function. We're hoping that in the next 1 to 2 weeks, coming 2 weeks, the heart will improve further, that we'll be able to remove this. And this is really a rebirth for her, if it goes the way we are hoping that it will go. Sometimes, some of the patients may require a long-term support of about 1 month, 2 months. And if his heart doesn't recover, few patients, like about 30-40% of patients may have to go for heart transplantation, which is available. Fortunately for people with a severe LV dysfunction, with bad hearts, today we have options. The assist device, which has been used for the first time in Andhra Pradesh at Yashoda Hospital, Secunderabad, and heart transplantation program, all these are available with us. And a few years back, these patients never had hope. Today, what is available in America is available with us, and we can confidently tell the patients that they have better chances to do well, even if they have badly damaged heart. This technology is not available anywhere in Andhra Pradesh, and this is the first time that this technology has been used here. And Yashoda Hospital brought this technology to help people who are suffering with bad hearts and who take the heart surgery one more step forward in our state. Now, what we do is we actually try to, when the patient comes, we assess our cardiology team assesses the patient. They do the echocardiogram, they do the angiogram, and then we sit together and then see what is the best option for this. See, so far patients like this, they are best left for medical management to the nature. But some of these patients, if there is an option that even if there is a 20% chance for survival after surgery or after balloon treatment, then we try to do that because life is so beautiful and we cannot give it back. But then it is a very high risk and the family has to understand this risk. We explain to them because when you do the surgery, if something happens to them, they have to understand that we had no choice. Fortunately, the family of these people, there are a lot of doctors in the family, they understood, they have seen the situation. So they accepted that this is the only way, this is the way that has to be done anywhere in the world, with the best of the facilities. This is the way to go forward. Fortunately, we had those facilities. We could offer to them. They understood it. And we had all the support. We had a big team of about 25 doctors, cardiologists, surgeons, anesthetists, physician assistants, and the anesthetists, perfusionists, all these people. We worked together as a team. And you could see the difference. A patient who has come off ventilator, who is able to talk, who is able to watch us, that gives us enormous professional satisfaction.
Thank you so much.
Thank you.
Shall we start? And how many are involved in this? What exactly? Just explain about that.
Team,
Like cases, is this the first time or it's been happened?
this technology is for the first time. Okay.
This case, I must say.
This case, we get multiple cases.
Multiple cases. So just explain about that.
This patient came to us with severe aortic stenosis. The valve in one of the left side of the heart was stenosed, and because of this the heart had failed. She had recurrent heart failure. Multiple times she had admissions to the hospital. where she needed a treatment with intravenous drugs and injections to bring her out of the heart failure. In spite of giving treatment, best medical treatment for this refractory heart failure, or let us say end stage heart disease, the heart pumping action was very weak and we could not improve it further. In this situation, what we planned was to do a balloon aortic valvuloplasty, which is a standard procedure for any patient with severe aortic stenosis. In spite of doing a balloon aortic valvuloplasty and having some improvement in the cardiac condition, the patient's condition remained the same. And for her, we had to intubate her and ventilate her for about almost a week. In spite of being on ventilator for 1 week, there was not much of an improvement in her condition, and we had to think of other options what were available for improving her general condition. Fortunately, we have Dr. Gokhale and team who had experience in this field, who had done previous cardiac transplants, and we thought probably we should offer her something more than the routine medical care, the best medical care which could not bring the patient out. In this situation, we suggested to the family that we can think of doing an aortic valve replacement, which is a standard surgery again in this situation, but in the prevailing heart failure, ongoing heart failure, it was a very high risk procedure. So in this situation, we thought probably implanting a left ventricular assist device, which is a device to help the heart recover its function, which is depressed because of the severe obstruction because of the aortic valve stenosis. Now, once the obstruction is relieved with an artificial valve, the heart muscle still takes time to recover. For this recovery, it may take about a week, 2 weeks, or 3 weeks, or 1 month. So for this recovery of the heart, we have put an extra assist device to assist the heart in pumping the blood so that the heart takes rest for improving its function. And with this, we will be able to recover the heart muscle function, and hopefully the heart will start pumping more efficiently. And definitely there has been improvement. The heart function before the surgery was about 15 to 20% ejection fraction. Now it has improved up to 30 to 35% ejection fraction. The blood pressure is much better. We have been able to take her out of the ventilator. The need for drugs to improve the blood pressure, to maintain the blood pressure, also has decreased drastically, and she is on the road to recovery. We pray that she does well and improves and goes home comfortably. No, the other conditions, bronchial asthma, hypertension, diabetes, are routine managed care. It doesn't need much of critical care management, except for this cardiac status, which was very, very critical. It was an end stage disease where we could not offer her much more than medical therapy, and we have even the balloon aortic valvuloplasty which we had done was not bringing her out of the present condition, and she was dependent on intravenous drugs, dependent on the ventilator. Nothing more could be done for her other than the maximum medical therapy what we have given. In that situation, we had to do this heart surgery, valve replacement with the help of an left ventricular assist device. No, this is not a heart attack. It is the muscle of the heart. It is the heart muscle which has gone weak because of the obstruction. So once you relieve the obstruction, the heart muscle will recover. Now to help in recovery of the heart muscle and to improve the blood pressure and perfusion to the organs, the blood supply to the other systems of the body have to be improved. For that reason, the left ventricular assist device has been given. Now, this technology has been available abroad for many years, but the technology is available to us at a higher cost. Now, a lot of patients who have severe heart disease, severe heart failure, who are not suitable, who are not getting more advantage with medical therapy, who have used the maximum medical therapy and still having maximum symptoms where they are not able to do the routine activities of life like washing themselves or having a bath or changing clothes. In that situation with severe heart failure, this left ventricular assist device will help them to bridge their recovery time so that they can recover faster and smoother.